only just a year since their launch, it has emerged as PH1, the Philippines' first digital healthcare. And today we shall find out more about this. And I'm sure you guys are going to be even more impressed if you aren't already. But first, let us welcome the man behind not only mWell, but the whole of Metro Pacific Investments Corporation. Let's give a big round of applause, of course, to our MVP, but also President, Chairman, and CEO of MPIC, Mr. Manny V. Pangilinan.
Thank you, Miss Universe. Thank you so much. I think you brightened up this room and the presentation online as well. Thank you. So thank you all for joining us today. So I join Catriona and welcome you in this press briefing of mWell. I'm happy to see all of you once again after our first launch digitally last year, which was July of 2021. But in a little over a year, mWell has transformed itself into a fully integrated ecosystem that goes beyond basic telemedicine or teleconsultation and has redefined the digital health space in this country. Metro Pacific Group's digital healthcare platform is part of our overall strategy to complete the health ecosystem for the Filipinos. mWell is designed to be the Philippines' first fully integrated health app, bringing together experts in technology, medicine, wellness, and healthcare in one sustainable living ecosystem. And today we're happy to share with you our many firsts. The first fully integrated health app in the country. It is also available globally for our Filipinos abroad and our migrant workers. The first to offer the most affordable telemedicine with free accident insurance package. The first to launch the biggest nationwide digital medical mission with hundreds of volunteer doctors simultaneously providing free consultation all over the country. The first to offer a free wellness score developed by data scientists. And finally, mWell MD, a cutting-edge, full-suite clinic management system designed by doctors for doctors. This mobile app gives access to quality healthcare and empowers our countrymen to be in control of their health as they rebuild their lives coming out of the pandemic. We will continue to set the standards in digital healthcare together with our hospital system, represented here by the president of our health system. We saw a number about 20, or is it 21? 19 headed for 20. As we build a healthier nation, but he's committed to double it in 5 years to 40 hospitals. And be recognized as the flag carrier for digital and innovative healthcare in the Philippines. Our final message is, lahat na ito ay para sa Pilipino. Maraming salamat sa inyo lahat. Magandang hapon.
Thank you very much, MVP. At this point in time, we would also like to acknowledge our very special VIPs who have joined us for this event this afternoon. Mr. Joey Lim, Director of MPIC. Mr. Stanley Yang, First Pacific Senior Advisor. Mr. Ricky Vargas, Head of Transformation from PLDT Group. And last but not least, Mr. Ogie Palisok, Vice Chairman and President of the Metro Pacific Health. Thank you very much for joining us today. I think you can all agree that mWell came at the right time. And I know that I speak for most of us when I say, not just because of the pandemic, but really healthcare has become such a huge priority for each and every one of us. And as people now navigate their new sense of normalcy, or newfound normalcy as we navigate the times, digital healthcare makes taking control of our health accessible and allows us to really put that focus of importance on it. Now let us discover what is inside the mWell app. Let's go on an app journey as we bring mWell screens to life. Let's watch this.
Welcome to mWell, the Philippines' first fully integrated health app. With mWell, you have a partner in every step of your wellness journey. It's so easy. Simply download the mWell app App Store or Google Play. Register. Log in. Feeling under the weather? We've got hundreds of primary care and specialized doctors ready to see you anytime, wherever you may be. You may choose to consult a doctor right away, or book an appointment with a doctor you have chosen from our list. On your appointment date, step into the doctor's clinic in a tap. After your video consultation, you will receive a summary of the doctor's notes and a prescription and have them delivered right at your doorstep. Need a medical certificate? You can have it for free. Aside from telemedicine, emergency service is also just a tap away. You may also find home care. Want to keep track of your health daily? Use the mWellness score. This exclusive feature lets you monitor physical activity, step count, and sleep for free. Looking for fun ways to stay active? Join exciting challenges and work your way up the leaderboard. In search for Fitspiration, we have fitness programs designed by experts, craving for healthy yet yummy recipes. Calorie-controlled recipes made by nutritionists are ready to be served. There's more. We also have an e-shop for best value consultation deals, insurance products, and other healthcare services. Behind all these features is mWell's purpose to bring healthcare closer to more Filipinos, especially to those who need it most. Because we believe each one deserves convenient access to quality healthcare and the best life possible. Empowering you to be in control of your health and say, I am well. Download the mWell PH app now.
Truly, the mWell app is a fully integrated app. To the mWell app user, as you just saw, you can book a doctor's appointment anytime from your place of choice, from home, from the workplace, wherever you are. You can have medicines delivered, get a medical certificate, get an e-prescription filled out. It is so convenient. And even if you're not sick or have a health ailment that you're seeking advice from, there are fitness and nutrition programs, lots of new and yummy recipes to try, even challenges to take part in, and even a health tracker that you can utilize every single day. And if you're also even wondering, which I found a really interesting addition on the app, is that, of course, mental health is a very important aspect. There are also access to psychologists, counselors, and support groups through the app as well. So it really gives every single Filipino, wherever they are in the country, that sense of empowerment that they can really take control of their own health, which shouldn't be conditional. It shouldn't be conditional on where you are and what you have access to. With mWell, every Filipino is able to have that power to take control of their health. It's pretty amazing, no? Well, talking about things that are pretty and amazing, let us meet the woman behind the inspirational values of the mWell team that really inspires them to break through boundaries and live up to mWell's commitment of bringing healthcare to all Filipinos. At the heart of mWell is the most awarded Chief Finance Officer who started sustainability 15 years ago when sustainability wasn't even a buzzword yet. And if I may share, we had lunch together kanina. And it truly is a gift to come into the presence and get to know someone who stewards their position of influence in such a positive way. And it really gives you that sense that their moral compass is in the right place. And when you imagine that person being such an effective leader, you start to see why a company, an organization really comes together and works together for the greater good. So, from one queen to another, and if I may title her the Queen of Sustainability in the Philippines, please welcome Miss Shea Capal-Revilla.
Ayokong tumayo kasi ang tangkad niya. Our awesomeness is only a reflection of our boss. So thank you for joining us here today. Hindi kami nagpa-practice dito eh. Kasi maraming trabaho. Okay, so I think we already saw what mWell is about. So we are not just a teleconsulting app or platform. We are into the entire overall health ecosystem. We want to push for wellness as well. So we have fitness feature, food and nutrition. We also have the mWellness bar. Especially Catriona kanina. Nakagabi, nag-zumba pa ako pag uwi ko sa bahay. Kasi I was scared that she's going to ask me my mWell score today. So I had to do exercise last night. We also have an e-shop and of course our advocacy program, which we will share with you later. What we do here in mWell is really aligned and hinged on UN SDG goal number 3, which is good health and well-being. Our purpose is to provide access and availability of complete health and wellness to anyone, anytime, anywhere. And this is also linked to our epic purpose of contributing to our country's progress and improve the lives of the Filipinos we serve. Kasi we know that health is very important, diba? For your livelihood, for learning, etc. And the reason why we have Miss Catriona here is because we want to bring the Philippine health ecosystem through mWell globally and universally. Kaya Miss Universe. You are universe. Uy, i-click mo na, baka kumanta pa ako dito. Okay, so as Boss mentioned earlier, we're actually the first one to create a very affordable pack for teleconsulting. No? So $399 for 2 consults with accident insurance worth $20,000. So as I said earlier, the things that we do is just a reflection of his values and his mission talaga to have the Filipino. So sabi niya sa amin, kailangan we make insurance affordable. Diba? So every Filipino can get it. So this is it. So we have also sa Shade, the insurance with mWell through our partners with Generali, Philcare, and many more. So yung ginawa namin sa Smart before with MVP, na sinashay yung telco loading, di ba? Yun ginawa din natin here. And with our partners in PLDT Global, ano sila, Edith siya kasi Albert, dapat hinahanap ka din boss dito, wala ka daw. Mag-teleconsult ka para i-try mo na nag-work there. So our mWell app actually works everywhere, universally, globally, universally. Yeah, anywhere. So our OFs are able to use it, even our tourists, di ba? So if you go somewhere else, like Albert is in Spain, if you're not feeling well, go and use our mWell PH app. And you can talk to and be serviced and helped by a Filipino doctor. Next. So this one, we're very proud of this. Aligned with our boss's heart to really help the Filipino. We launched the first digital medical mission. So we will share later, diba, that we reached many IP communities who have never been reached by medical doctors or health workers. And they will personally share their story later. And we also have this thing on our advocacy app, Asan Sila Chi, where our doctors are able to donate their time and do free consult. This is going to be in collaboration with the DSWD, who will issue the health codes for the indigents. I don't know if Gurab is here, our partner from Activo. They are the ones who actually did our mWellness for our partner. And Jeremy from Activate Me, he's an Olympian boss. So siya yung sa fitness and nutrition. Okay, next. So this is mWell on the go. We actually made a health clinic available in a bag, in a pack, where you can give it or bring it anywhere. So we brought it to IB communities, and we've also brought it to LGUs that actually have no health clinics in some of their far-flung barangays. So this one was done during our National and Wellness Day in August. And please watch this video.
Ito pong aming barangay, ang isa sa pagkakalayo sa ospital. Mahirap po, pag lumalaki ang dalawang ilog, talagang ang aming sakit talaga ay hindi namin malabas.
Dito po sa amin, katulad po dito sa daan, pag lugod tag-ulan ay talaga pong napakahirap ng daan. At may doon nga pong dito sa daan ay namamatay ng pasyente. Hindi na nakakaabot ng ospital. Ay sila po'y parehas po sa ospital namatay. Yung pong isa magbabayang-uno, yung isa ay magtatatlong taon. Ako po parang nawala sa sarili. Ang hirap po palang pamatyan pamilya ng ka-edad. Paganda po nung inyong dinalang iyon at gawa po ng talaga pong rektahan na po sa doktor ay
Kami lubos-lubos ng papasalamat at malaking bagay sa tulong namin malalayong barangay. Sila nag-gusto kayo na ako ng hospital para magpasikat. Ito pa lamang ay nakausap na ng kanila. Pangalaman nila kung ano ang kasalamat.
Okay. So with us here at mWell, ito yung ating mWell on the go and everything that's inside it. We really feel and we do this because we know that health is a basic right of everyone. And we want every Filipino to be healthy and well and happy. Wait, but there's more. This week lang, we didn't sleep because we pushed for many more features into the platform. So we're actually including also a home care feature. So when you click on the button or the tile, you will be directed to Health Link, which is a doctor, mga ano sila of doctors, no? Headed by Dr. Raul Destura. By the way, DOYM awardee siya in 2011 was. Very brilliant and good-hearted doctor. So we're working with them on home care. Next. Mind health, as Ms. Catriona actually mentioned earlier. So our pool of psychiatrists, psychologists, and counselors actually cater to everyone, adults and even children. I think we mentioned this earlier. When you click into your e-prescription, you will also get a one-click also to order your medicines from MedExpress. And you will get it delivered to your homes. And this one also is a first. It's actually our local 911. So there's a button there. When you push the emergency button, you'll get directed to Lifeline for ambulance to come to your house. And then this one, we're particularly proud of this kasi we also did sleep. So if you see here, we have a wellness, wellness watches and wellness wearables. So this one, you can integrate this with your mWellness score, and then you will get scores every day based on your exercise, your light activities, your sleep, ganyan. And as sharing with Ms. Catriona earlier, the more data in your app, the more that you will be able to do predictive analytics, because we're also partnering with huge AI people who can, tell you, Stan, if you do not sleep every day, if your blood pressure is high, then you're likely to, Okay. So this one, we will actually make this available also on the ring, the health ring. So Kat, actually pwede siyang gamitin na wedding ring, di ba? So pag kinasal kayo ni Sam, huwag ka na mag-health ring na din kayo. You know why? Because you want to live happily ever after together, right? So,
Sickness and in health ba?
correct, very good. Uy, pwede natin ito ibenta ng wedding ring. Tandaan niyo ba? Yeah, tsaka boss. Meron siya. So this one, si Gary also launched this nationwide Zumba challenge, which you will also find in the app. Yun. So kami, nagsusumba kami dito lunchtime and after office hours to increase our steps and increase our wellness score. We've actually gamified and made being healthy fun. This one, we did a POC with mga LGUs that actually need our equipment and our teleconsulting services in their barangays. So we've done this, and we will emolize everyone in the country through our services and our offerings. So another one that we're actually offering with our LGUs is the Digital Health ID. It's not just for the LGUs, it's for everyone. Because now you will be empowered to have copies of your medical records and information. And it also has a scanning mechanism when APJ, when we go to our hospitals, MBB does not have to fill up his information, diba? Like 5 pages and everything. So you just scan your QR, your digital ID, and everything will be there. And Doc Mike, diba, we've also made a feature to do cross-referrals sa mga doctors. By the way, this is Doc Mike. He's our Richard Gomez of mWell. He's a real doctor and a CPO. And then this one, then we will make that kiosk available. Kasi we thought about the reach for mWell, no? Kasi digital siya. And only 45% of our country has smartphones and Android phones. So what about those without smartphones or do not have e-wallets? Eh, di ba we want to be inclusive kasi doing this for the UHC Universal Healthcare. So we're actually partnering then with our affiliate, Bayad centers, so that our kababayans will pay in cash in the Bayad centers and get the health passports for those who have phones now or smartphones, and then get their teleconsult para dun sa mga walang e-wallet. However, for those without both e-wallets pa, because we're transitioning pa there, and smartphones, they can actually go also to the Bayad centers, and then we will provide kiosks like that. So para siyang sulong clinic na rin. And we've talked to Smart, and we will do the same thing for our retailers. So sa mga sari-sari store, pwedeng pumunta na yung mga taong kailangan mag-teleconsult and use the retailer phones. So we're doing that with Smart also. This is really, truly democratizing healthcare. At ayan ang utos ng boss namin sa akin. Itong MLND, si Dr. Richard Gomez, baka magalit si Lucy Torres sa akin na lagi kong sinasabi yung asawa niya. Si Doc Mike will actually explain it later. So, the ones that we described to you are user-facing tayo. Sa mga doctors naman, they have a different experience because they really have a beautiful platform on the doctors. And the many doctors that we talk to, sabi nila, atin lang yung merong capability to do video and all of their notes and clinical medical records, Doc Mike side by side. So they can check the records of their patients while they're talking to the patients on video. So, this is my last slide. Thank you to our partners, Microsoft, Delos, Highly Succeed, where is she? And then, PLDT Cybersecurity, when we designed the platform, they were there because we are mindful of cybersecurity and data privacy. Bayad, I mentioned. Maya also is our payment and fulfillment platform, by the way, Activo and Activate Me. I also mentioned earlier. Did I say Telos na? Hi, Charbel from Canada, they're watching. And Bong Mohica from Europe. And of course, Metro Pacific Health through APJ. We're working closely with our hospital group, Cardinal Santos, Smart, I mentioned, and all the big wigs of PLDT Enterprise, Global, and Home. So everybody, our thrust is to embellish the Philippines with good health and wellness.
Thank you very much, Ms. Shea. As you guys can see, the list of mWell firsts are endless. It's very, very impressive, and you can see why it's undoubtedly PH1. But we've seen it on the screen, but why not witness how it is done in person? So let's put it into practice, shall we? Let's experience how easy it is to consult with an mWell doctor. At this point, I'd like to invite up top columnist from the Inquirer, Ms. Dolly Ann Carvajal, and Ms. Lorraine, our head of operations. Could you please show our special guest? Here she is. Just how easy it is to consult with an mWell doctor.
Thank you, Ms. Kat. Hi, Ms. Dolly. Kamusta?
Talaga ako.
Oo nga.
Magiging guinea pig pala ako today.
Ay, gano'n. Hindi naman.
Ako bang pinaka-unhealthy dito? Kaya ako ang napila ni gano'n.
Release your inner beauty queen.
Okay.
How are you feeling now, ma'am?
Good naman.
Oh, good. Sige, let's maximize our demo for today. If you don't mind, we'd like to share with everyone your mobile phone, particularly your account in mWell, so that we can all give them an idea how easy it is to book a consult now in mWell. Okay. So, clinic na natin, no? mWell app. If you notice this portion, as a patient, you will see all the services that you can avail in mWell. Diba, madami siya. Ang ganda, okay.
May Dr. Love pa dyan.
Ay,
Puro medical problems
we can
lang.
onboard in 1 hour.
Oo.
At Dr. Love. Okay?
Okay,
Alright,
para
sige.
maiba.
Another good thing about the homepage, ma'am, is we strive to give you as much information as we can about our doctors to help you decide who to book. Yan. So if you notice here, ma'am,
Categorize.
oo, categorize siya, and then you're informed how many years
Specialization,
experience.
yes.
Oo, specialization.
Pati yung
ma'am.
fee nakalagay na dyan.
Correct.
Yung-
So that you can apportion your budget. Diba? Okay. And particularly po for specialistas, you are informed how many days you are available. Yan.
24/7 talagang.
Yes. Oo. We have doctors available 24/7 as
Mas
well.
mahal ba ang consultation?
Hindi naman kaya naman ng budget. Oo. Kasi our goal is to democratize healthcare and make it available, hindi masakit sa bulsa. Okay. Sige ma'am. So let's scroll up. And then kindly click consult now. There you go. So you can decide kung sino po ang magbo-book. Yourself, your child,
You can book also. for your
yes,
family.
your parent or someone else. Okay, so in this case, you can click myself. Click lang siya ma'am. There you go. Ayan. Okay, we click next. Okay. This is the part where you have to input your full name, date of birth, at saka gender. Mag-age reveal ba tayo mamaya?
Ang birthday, oo nga. Yung year mo lang i-review.
Oo, pwede nang itago yan. Okay. Yeah.
Flash dito sa screen.
Oo nga, sige. mag-scroll down tayo. But that's very important kasi ang ilalagay mong information doon will be reflected in all the documents that you get after consultation. Tapos in mWell, dinefine na po namin yung top reasons for teleconsultation. So ma'am, do you have cough, cold, fever, stomach pains, or meron kang gustong iniisip?
Mind health, ganyan. Kaya nabakuliw-kuliw ako minsan.
I-click ba natin yun ngayon, ma'am?
Baka matagal yung consultation.
Kasi that's 1 hour
Insomnia
na.
na.
Insomnia. Sige po. Alright.
Sleeping problems.
So yeah, so ito yung, we will put here sleeping problems.
I sleep with the wrong man.
Wait lang, ma'am. Wait lang, nakaroon tayo pag type ko. Hindi ko alam kung anong sleeping problem ba ito.
Do you have the problem also?
Actually, we have
So,
psychologists.
in Tinder solo.
Ganon.
Di ba?
Sige na ma'am, itulog na natin yan. Okay. So, alright.
Dapat parang si Julius din.
Correct.
Sleeping mo. Okay, game.
Natawa ako.
Naku, dapat pala wholesome na dito sa MVP.
Oo, ma'am. Sige,
Oo,
let's read it in a little bit.
Okay.
Mamaya konti na lang tayo. Meron tayong drinks later sa office. Joke lang yun. Okay. If you're okay with everything that you've inputted, please accept the terms and conditions. Click natin and then click next. Yan, alright. So right now, you will see all the doctors that are available.
Kasi pag gwapo dyan.
Ay, gwapo. Ma'am, lahat ng mga gwapo natin ngayon naka-duty kasi nag-service po tayo ng 4 na barangay health centers as we speak. So we actually have 8 dedicated for that project. Nakabook sila ngayon doon. Okay, so, oo nga eh. Alright, so if you want, for purposes of our demo, we can choose the doctor with the mWell badge, meaning yung may company logo po sa picture. Sige ma'am, click mo na siya.
Dr.
Alright.
Aquino.
So that's Dr. Priscilla Aquino. She's been with us from the very beginning. And for the purposes of this teleconsultation, we'll make use of a health pass. Pero ma'am, kung kailangan magbayad, just use your Maya card.
Pwede.
Or any debit card and credit card. Okay. So para ma-avail natin ng health pass, because that's something that we are giving or working on with our LGUs, please click this portion. Wait lang ma'am. Balik tayo. Ito po, check available health pass. There you go. Alright, all the health passes available will be displayed to you. Please click use now. Alright. And see na wala na siya. Okay. You can now click proceed to payment. Okay.
Charge to Gary Duhal.
Yes, all of it. Yan. So now we've entered the waiting room. Baka nagtataka ka, ma'am, consult now, tapos may waiting room pa. Usually, we take time to get ready to face our doctors. Tapos if you are perhaps nag-book ka po para sa anak mo or pamangkin mo, syempre ginagawa mo pa siya. Yun. So may waiting time po talaga yung mga Pilipino. We take time to get ready for our, yes ma'am.
Digital waiting room. Kasi ang Pinoy does not really come on time, di ba? So we're giving last 10 minutes to the doctors and the patients. Kasi,
Oo, pero ma'am, if you think about it, the 10-minute waiting time, it's very, very manageable compared to, let's say, pag nagbiyahe ka, how long you travel, right?
Doctor's office.
Oo,
May
now-
queue talaga.
Okay, so now our doctor has accepted our booking. And then, okay, there she is.
Hello?
Yan, so please say hi.
Hello, good afternoon po. Ma'am Dalian, Tarbakal,
Yes.
correct?
Yes.
Okay, hello, good afternoon po, Dr. Aquino po ako. Sige, kamusta po kayo, ma'am? Anong tatanungin?
I'd just like to consult kasi I've insomnia. Is it safe to buy medicines over the counter? Or kailangan may prescription?
Okay. Sige, first of all, kailan pa po nag-start yan?
Since birth. Since I was a teenager.
Teenager. Matagal na. Sige, go ahead po.
And I think it runs to the family because most of us have sleeping problems. I define
Ay, sleeping problems talaga. Sige po. Usually, how many hours per day kayo tulog ninyo?
4 hours. Di ba dapat
4 hours. Pero, pag nag-sleep kayo at night, hindi na mag-initiate ng sleep or parang pag maghiga na kayo, hirap ba kayong matulog pag usually ilang hours bago kayo makasleep.
Limit on Netflix. Oo. So, dapat siguro, depende daw sa katanda, sabi ni Tintin.
Pero recently, wala namang pressure in life, wala namang problem.
Kailangan naman.
Kasi, oo, kasi usually nakakaano yan, no? Nakakadagdag ng cause talaga pag nagkakaroon tayo ng pressure in life, problems, pwede tayo talaga magkaroon ng sleeping problem din, magkaka-insomnia, no? Pero, have you taken any medication for that?
I tried Sleepasil. Pero ulit naman.
Sleepasil? Paano niyo po sa inyo, yung Sleepasil?
Before sleep, mga 2 hours before sleep.
Okay.
Medyo nag-work naman siya, pero parang the
the
more I use it, hindi na siya effective.
Hindi na effective po. Pero usually, ilang weeks ba ninyo yun ininom? Or
Siguro
short
2
time lang?
weeks lang.
Okay. Ano po yung bedtime routine ninyo? Anong oras kayo what time do you go to bed?
It varies. So dapat may staggered time.
Oo. Meron po ba kayong ibang sakit? Like high blood, diabetes, sakit sa puso,
Wala naman, as far as I know.
wala naman.
She's already making her consultation notes. After the ready na po siya.
Yes, opo. Okay. So, eto po, since meron tayong sleeping problems, so I advise, stick talaga to a sleep schedule. So, you have to, siguro pag sa gabi, you go to bed na ng 10 o'clock para talaga maka-sleep na. And then, tomorrow, and kinabukasan na, ganun ulit. So, dapat yung sleeping pattern, no? And keep your bedtime and wake time consistent talaga from day to day. And, siyempre, kahit masarap mag-nap sa hapon, no, you have to avoid and limit it. Kasi talagang pag nag-nap tayo sa hapon, medyo mas mahirap matulog sa gabi. Okay? Mahilig po ba kayo sa coffee?
No, I don't. It's not my poison of choice. Gary knows my poison of choice.
Okay, so thank you very much, Doctora. Oo, meron na po tayong dadagdag. Pwede na po tayo mag-build ng ating consultation notes.
Yes. Oo, pero the other thing po pala is, yung prescription natin, no, I will give you a prescription for melatonin. So, the melatonin that sleeping hormone, sleeping pills na pwede natin. It's an over-the-counter naman, sir. I'll give you a prescription for that. Next, you can download ito sa mWell app natin, no, after ng consultation natin. So, after I finish the consultation note and prescription, you can all download it sa mWell app natin. Okay?
Thank you.
Okay, so
Sige,
thank you
meron
very
po
much.
question?
We're good, Doctora. Thank you very much.
Thank you.
Alright, thank you so much po. Okay,
Alright.
have a good day. Bye-bye.
Salamat. Okay, so already at the call, ma'am? Okay. Congratulations. Natapos ang ating teleconsultation. And as we see, yan, you can buy your medicine in mWell via MedExpress or add on to anything that you need for health via insurance. Pero para malaman mo po yung kailangan mong bilhin sa MedExpress via mWell, you have, of course, available already your prescription.
Instant, nandiyan na.
Ayan, o nandito na siya, yung sinabi ni Doktora kanina, or perhaps kung kailangan mo ng medical certificate, it's already available as well. Ayan. Okay, so congratulations, mamimili na tayo na facilitator via MedExpress. Okay.
Depends.
Alright. Thank you so much, Ms.
Thank
Dai.
you. Thank you.